everyone, Christos here. Today we're going to be talking about the hip. What if your hip pain was all to do with stagnant hip muscles that aren't being used properly or aren't moving properly? Many people who have first come see me in clinic with hip pain have seemingly hips that just don't move anymore. Maybe due to previous injury or surgery and injuries elsewhere in the body, because everything affects everything. So to understand why this stagnant hip could be causing pain, we're going to first look at the basics of the anatomy of the hip, the movements of the hip, and why we need movement at the hip. And then lastly, how we can go about bringing mobility back to these muscles for efficient forward movement. So let's get started. What is the hip? Well, the hip isn't just this bone on the outside. Many people go to their side to touch their hip, but that's not actually the hip. The hip is this area, the groinal region, the connection point between the head of the thigh bone, specifically the head of the femur here, and this cup-shaped area of the pelvis known as the acetabulum. So this is the hip joint, not this. The hip joint has muscles surrounding it. The back and outside of the hip, colloquially known as the gluteal muscles or the bum muscles, and the inside of the hip here, the adductor muscles, also known as the groinal muscles. So the groinal muscles and the butt muscles are what protects the hip joint from excessive stress. And why do we need protection? Because we take many steps a day. Some people take 10 to 20,000 steps a day. Every time we hit the floor hits back. And so if the floor hits back, we need muscles to absorb that shock, pretty much brake the forces. Like you would on a car, you brake to slow down. That's what your muscles are designed to do, to slow down and reduce excessive stress at the joint, as well as use that stress productively by stretching, like this you see me doing on my arm, to then contract, so the hip muscles can contract and catapult us forwards in space. So that's the anatomy of the hip. The movements of the hip in the walking cycle, well, there are many, but the hip can what we call move in 3 dimensions: forwards and backwards, side to side, and turn in and out. A brief example: when we go to step forwards, the pelvis bone, which is part of the hip, will close or should close the hip at the front and open it at the back to stretch the muscles at the back. The pelvis is going to move close to the front leg so we can confidently weight bear on the front leg, which will stretch the muscles on the outside and close the hip on the inside. And then the pelvis will turn away from the front leg to allow for space to really get into that front leg. Now, it's the stretching of the muscles around the hip that first of all means the hip isn't stagnant, but really it's to allow the muscles to absorb stress, like I've said, and propel us forwards in space. So this 3-dimensional action is very important, and this requires the pelvis and the thigh bone to move quite a lot. So these people in clinic with stagnant hip muscles just have a pelvis or a thigh bone that doesn't move enough. So what can we do about it? Well, we just need to get the pelvis and the thigh bone moving better. And you can start simply with this. If you take a stand with feet hip width apart, I'll show you here, we can tilt the pelvis down. This is one of the movements needed to allow muscles to stretch at the back. So you're just tilting the pelvis down by thinking of the front knobbly bits moving down towards the front of the feet. We can also move into either side hip by bending a leg, and when you bend the leg you will shift into the opposite side hip. We can go both ways. Nice and simple, but also very effective. And then we can turn towards either side leg. You can turn and then straighten the knee you're turning towards and go both ways. You'll feel how this kind of wakes up the outsides and the back of the hips here. So those three motions happen when we step forwards, which is important because the ground's going to hit us, so we need to be able to break the forces. It allows the hip tissues to move rather than be stagnant. It keeps the hip joint happy, and so your likelihood of pain reduces and your efficiency improves. Thank you.